Hello, my name is Amanda Williams, and I'm an education specialist with the nursing and patient education team here at Baylor St. Luke's Medical Center. Today, I will be going over alarm management for our acute care areas. We'll take a look at our policy and your responsibility while monitoring these patients. First, we will go over our policy and how it pertains to patient care. Our central monitor should always be set and audible at 60%. Heart rate alarm parameters should be set accordingly. High alarm at 120 beats per minute or 30 points higher than patient's baseline, and low alarm at 50 beats per minute or 15 to 20 points lower than the patient's baseline. These alarm limits may be extended when patient is ambulating. Arrhythmia alarms will alarm as such. Crisis alarms. They will display as a red alarm and sound accordingly. They include rhythms such as asystole, ventricular fibrillation, and sustained ventricular tachycardia. Warning alarms will display as a yellow alarm and sound accordingly. They include ventricular tachycardia, ventricular bradycardia, accelerated ventricular bradycardia, and pauses. Advisory alarms will display yellow alert and alarm accordingly. They include ventricular couplets, bigeminy, trigeminy, tachycardia, and bradycardia. Message alerts will display yellow and alarm accordingly and include PVCs or premature ventricular contractions and irregular rhythms. ST segment alarms should be set at plus or minus 2 millimeters above and plus or minus 2 millimeters below the patient's baseline. All patients on telemetry must have an order and also an order for discontinuation. The RN is accountable for analysis and interpretation of a patient's EKG strip, as well as placing it in a patient's chart. Interpretation includes measurement of PR, QRS, and QT intervals. This should be done for the initial ECG strip at the beginning of each shift and when significant ECG changes occur. It is the responsibility of the RN to assess that all alarms are on and audible, as well as make sure the alarm parameters are correctly set for each vital sign for each patient at bedside shift report. It is also the responsibility of the RN to respond to all alarms and assess the patient, monitor battery life and change needed, reapply leads when needed or the telemetry is not reading. A dedicated phone line with a unique ring will be available on every remotely monitored telemetry unit for communication with the monitor tech and RN. The following vital signs must be documented at minimum every 4 hours in the acute care setting unless otherwise ordered. Blood pressure, respirations, heart rate, oxygen saturation, and temperature. The provider must be notified in these instances. Patient refuses monitoring, vital signs are out of ordered or set parameters, any rate or rhythm changes, or patient symptomatic with vital signs inside these parameters. In the event the EMR is down, charting will be done on the downtime forms. In conclusion, management of monitoring alarms, including audibility, correct alarm parameters, and patient's condition while being monitored, all fall under the responsibility of RN. Immediate assessment of patient when alarms are sounded are required, as well as provider notification of change in status. Diligent management of patient alarms will greatly increase our culture of safety, patient satisfaction, and patient care.